Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Kory Langwell. Kory earned his Bachelor of Science degree in kinesiology at Sonoma State University. While playing junior college baseball, Kory suffered an injury needing physical therapy and realized that physical therapy was the career choice for him. In 2010, he received his Doctorate of Physical Therapy degree from Western University of Health Sciences. He has had the opportunity to work in a variety of rehab settings, including acute rehab, outpatient orthopedics, pediatric and neurological rehab. Kory was born and raised in Arroyo Grande, California, near San Luis Obispo. Outside of work, Kory enjoys playing sports, hiking, exploring all that California has to offer, spending time with his family and friends, and living a healthy lifestyle.
Thanks for coming out, everyone. It's nice to see some familiar faces in the crowd, former patients. I work at Washington Outpatient Rehab Center, right across the parking lot, actually, the large 4-story building with the green windows that everyone has a hard time finding. We've been there for a little over a year, and we have a lot of good therapists working over there. I'm going to go over some fall prevention, fall recovery, basic anatomy, like I talked about, different conditions of the back like Dr. Eichbaum did, and other issues, posture, things that can cause low back pain, and then just show you guys some exercises at the very end. So kind of jumping in, back pain, as we know, it's seen in a large population. Pretty much everyone has low back pain at some point in their life. He found a study that said 80%. I've seen 90%. So basically just everyone has low back pain, pretty much. It's one of the most expensive disorders in industrialized nations, with the US being affected the most. The lumbar spine, I have it squared there. L1 to L5, you have your thoracic or your mid-back. If you hear your doctor talking T1 to T12, that's your thoracic, mid-back, and then you have your neck, your cervical spine, C1 through C7. Underneath the lumbar spine, you have your sacrum and your coccyx. So we have bones, we have joints, muscles, nerves, connective tissue. All these form spinal segments to make us a more functional being, a more mobile being, and create stability throughout our back, while protecting our spinal cord, which is, as we know, vitally important. Looking at this picture, this is kind of the top slice. I like to think of the discs here as what they told us in school. It's almost like a jelly donut. So you think of, it's got kind of this jelly-like gel tissue in the middle, and then on the outside it's got more of a fibrous matter to it. So you'll see it either bulge or herniate in certain patients. We'll go over that in a little bit. So here you can see a nerve root coming off the central cord here. So right here is a peripheral nerve. This can push out onto the disc can push out onto the nerve, and that can cause pain down your leg or in your neck. If it pushes out onto the nerve, it can cause pain down your arm. So you see a lot of those symptoms in people with low back pain. The muscles, as therapists, that's kind of what's what we hang our hat on, the musculoskeletal system in general. So the flexibility of the joints and muscles, they play such a huge role together. They act to keep us really stable, to allow mobility, but protect us as well. They can be injured directly by trauma. They can be injured, sleeping. A lot of times patients come in and they have these little aches and pains and their back hurting or their neck or whatever. And so certain movements, trauma, all that can happen, and also muscle spasm for protection. So what you'll see a lot of times is that the muscles just will tighten up. You've probably all had that, either in the low back or whatnot, and that's just our kind of our body's way of telling us, what are you doing to us? You're hurting me. Stop what you're doing. So just some, I'm not going to go over too deeply into the anatomy, but you see one of the muscle groups that's really important in the low back is the multifidus muscle here. It's a real deep muscle, and it takes the pressure off the discs by kind of just distributing the weight along the muscles, and it's on both sides, so left and right. It's actually beneath the erector spinae on the other side. So on the left side, you see more of a little bit more superficial or medial view, middle view, and then the deeper view on the right. And what that'll do is also help to decrease degeneration of the spine. So it's just a very deep muscle, and it's something that we help train in physical therapy from the get-go. It helps with extending your back along with the erector spinae. That's the main motion or the main action of the erector spinae here, is to help extend the back. And then the multifidus also helps with side bending and rotation. So they have proprioceptors or nerves with them that kind of help. They stay one step ahead of us. So they kind of, with our brain, nerves, muscles all working together, they know before, if we're going to lift our arm, they're going to get activated on that side as you're about to lift your right arm. So it's very important. They found a lot of studies that the multifidus in people with low back pain don't typically fire at the correct rate, or they lag a little bit. Moving on. So just a good picture of the ligaments. When you think of ligaments attach bone to bone, whereas tendons are muscle to bone. So ligaments function primarily just to keep us nice and strong, nice and stable. So you see, you have the anterior portion here, the ALL, you have the PLL, and they're also between the spinous process, which are those bony projections on the very back side of the spine. So common causes of low back pain: muscular strain from trauma or waking up on the wrong side of the bed, herniated disc causing radicular pain such as sciatica, which so many of us have suffered from, stenosis, spondylosis, spondylolisthesis, there's that word again, osteoporosis, and there's a lot of different causes, but these are some of the big ones that we see in the clinic that I'm going to go over and touch on here. So this is a picture of somebody's low back. I would hope that nobody would have all these things going on at once, but this is just showing different. At the top here, you see a normal disc going on. You see a degenerative disc, so it just kind of starting to wear down. You hear people, I used to be 5'10", and now I'm 5'7.5" or something. So you see the water height in the disc starts to decrease little by little, and with 30 plus height, 30 plus discs in our back, you get that height loss there. Bulging disc going down, you see that it's just kind of sneaking out the back there, which can push on the peripheral nerves and cause some pain down into the back or into the legs. The next disc, you see a herniated disc, which is where more of that jelly, the jelly from that jelly donut, if you will, kind of pushes out onto the nerve root even more so. Thinning disc also kind of relates to the degenerative disc, so it just kind of starts to create less space there and create those vertebrae almost touching, which can cause some issues with the nerves. And then very last one, you see an osteophyte formation at the very bottom here, and osteophytes are just bone spurs. So sometimes they'll, obviously first case, they try to get you into therapy, do more conservative treatment. Those typically, from what I've seen, people heal pretty well from them. It just depends where they're at though, and a lot of times they will end up doing surgery if there's, way down the road though. It's not something we want to jump to. We don't want to get you under the knife if we don't have to there. So spinal stenosis. So what you see here is that position of comfort becomes flexion or bending forward. These are the people at the grocery store holding onto the cart. I feel great when I hold onto the cart because I'm leaning forward and it's comfortable. There's a narrowing of the opening either centrally or on the periphery of the vertebrae, and usually that's caused by wear and tear, osteoarthritis, or things of that nature. What you see a lot of times in these people, because they're bent over so much, is that their hip flexors and some of the anterior structures become shortened and weak, and then they also are weak and a little lengthened on the backside because of just that posture. It just kind of lengthens them out. So in PT, we're trying to figure out not only what is the diagnosis or whatnot if they have stenosis. That's just part of the picture. We need to figure out what muscles are tight, what's shortened, what's weak, and then just kind of start a laundry list and start checking things off with the right exercises and activities for them. So a lot of times these folks, bike is great, a recumbent bike, a stationary bike, because it puts them in that seated position where they're more comfortable. They can get stronger in the hip flexors and the core. Swimming or water aerobics, a lot of times with a lot of these cases are great. A lot of times we'll refer people out to water aerobics. So extension exercises, so anything where you're going into extension is typically really uncomfortable with these folks, just because that creates more narrowing of the spinal column there. So really like bridging exercises where you're lifting your hips up off the ground, things like that aren't really indicated with these folks because it's just too painful. And sometimes we'll put like a stability ball, a big ab ball underneath their stomach, and you can create with them laying over it, that will create a little flexion in their spine, so they're able to do certain movements with their hands and knees to work on strengthening there. Spondylosis is just a word for spinal arthritis. So again, occurs from years of wear and tear. Starting from a young age, children, you see kids these days, they're wearing these heavy backpacks that really should not be more than about 10% of their body weight, because you're setting themselves up for pain later on in their life, once they, 30s and beyond. And then for all the rotational athletes like baseball, softball, golf, tennis, things like that, you really want to make sure that you're training the opposite side. So if you're a left-handed swinger or right-handed, you want to make sure that you train the other side. That's going to create more balance in the muscles of the spine and create less torque on the spine, because you don't want one side that's way stronger than the other. Spondylolisthesis. So you see this a lot of times. What it'll do, they grade it from 1 to 4. So from least severity to most severity. So grade 1 is 0. It goes in 25% scales. So you go 0 to 25% is grade 1, grade 2 up to 50%, grade 3 75, and grade 4 over 75 to 100%. And that, what I mean by that is the slippage or the amount of movement on the disc below it. And it can be anterior or posterior, front or back. Typically with these folks, exercise helps to ease the pain. Again, we're trying to figure out what's causing issues with this. So there's underlying causes. You could have tight muscles one area, weaker muscles in other areas. Higher risk folks, gymnasts, a lot of our folks that we see with this, they were collegiate gymnasts and now they're in their 50s. These athletes, they get older. The problems stick with them that they had, that they were able to fight through when they were in their teenage years. They're able to, they start showing more as they age. And then during pregnancy or even with obesity, you'll see too much hyperextension because it causes damage to the ligaments. They'll get stretched out, which causes those vertebrae to start moving just slightly. So, and then again with these folks, extension exercises should not be done, and focusing more on finding what's going on, tight and weak, and then trying to correct that as best we can. Osteoporosis, this is such a huge one. It's oftentimes referred to as a silent disease since it depletes bone mass without symptoms and pain. So most people, I've seen 30-year-olds that have backs that look like they're in their 70s. So 10 million Americans are estimated to have it, and 34 million are estimated with osteopenia, which is just a weakening or it's kind of the precursor to osteoporosis. Children are getting 33% more fractures than they did 15 years ago, girls more than boys. Most of that is the sedentary lifestyle. As technology gets better, we seem to get more and more sedentary. We're not like we were back in the 1800s and farming and all that good stuff. So you see also nutritional components. Soda, certain acid that's in soda can help or can actually decrease bone mineral density, and that can also help break down the bones quicker. Diabetes, you see type 1 diabetes, typically there's an association with lower bone density. And then type 2, usually these folks just have more of a sedentary lifestyle, so they see a link there. And then with hypertension, you usually see they're not getting enough calcium in their diet. So, and then it also kind of ties in with a sedentary lifestyle. So there's a lot of things that are mostly sedentary lifestyle based that can create these osteoporotic changes. I don't remember when I heard this, but at one point I had heard healthy bones don't break, diseased ones do. So you hear about these folks that they have a hip fracture. They fell and had a hip fracture. Well, a lot of times they break their hip first and then they fall. So it's kind of, their bones were in such bad shape that it caused a fracture and then the fall. So kind of the chicken or the egg, what came first there, the fracture or the fall. Definitely underdiagnosed in men. And active lifestyle is important, as I was saying. So bone is living, growing, and regenerating tissue. So the more you're active, the more you can move, the better off you're going to be. So, and I know it's tough with low back pain. We get a lot of patients that say, I just can't move, I'm in so much pain. But coming to therapy, we do a good job at trying to mold a program to you specifically, not just a cookie cutter, you're going to do these certain exercises and you're going to get better. Trying to take a whole approach of, what do you like to do, and then trying to find certain activities that's going to be good for your certain case. Arthritic changes, so pain and morning stiffness is very common in these folks. So I try to get people moving right before they get out of bed even. Simple bed exercises can help alleviate the pain. It increases the blood flow, decreases the stiffness a little bit. So instead of just jumping right out of bed to get that coffee going or whatnot, trying to get going, doing some ankle pumps, heel slides, glute sets, and I have some pictures of those later on. Sitting too long can cause pain. Get up and get moving. We see this so often with people that are inactive, just trying to get them doing whatever they can. So a lot of times in therapy, we'll try just getting people going with some standing exercises. That's going to help their balance as well to help prevent a fall. Also improving their strength. And then if they need some rest or they're getting too tired, then we try to do some sitting exercises and get right back into some standing exercises. And then the big thing, you hear the no pain, no gain thing that was probably huge about 30 years ago. And then trying to get that out of people's head, for the most part, that's kind of an athletic thing. But what we're trying to do is, if it hurts, don't do it with these issues. There's no shame in just figuring out what you can tolerate. If you can't do 10 reps, do 5 reps. Modify until you can do more. So trying to figure out what you can do and moving on from there. And the exception oftentimes is the radiating pain down the leg or the arm that improves with exercise. So this goes into that sciatic type pain. So oftentimes it will hurt more in the beginning, but it'll improve with exercises with the right motions. Typically those people, depending on where the disc bulge is, you either need to go more flexion based or extension based with those exercises to help that disc get back into place. So goals, working with some of the folks with back pain, really improving the balance to reduce fall risk, reducing further bone loss with more activity, improving posture and reducing postural associated pains. So we don't want to, if somebody looks like a question mark, they're bent over like this, we don't want to strengthen them in this position because that's just not going to do anything good for them. So trying to improve their overall posture in their upper back, their low back, their neck to create a more functional movement pattern. And then improving overall muscle strength, so creating, like I just said, from a more functional, stable, mobile person. So you see, so many of us look like the person on the left. I know I was sitting over here during Dr. Eichbaum's looking over my notes, and I was definitely hunched over. So you want to be aware of your posture at all times. So we all do it. We all slump. It's just how often do you get out of that position and how quickly you can realize what you're doing and try to correct it. It creates a lot of stress throughout the thoracic spine. You see this kyphosis, or this kind of that humpback posture here that can lead to straightening of your low back, or the natural lordosis that we want here, this kind of slight little bit of a sway back. That puts a lot of tension when you're sitting in that position and can cause some back pain. So you see the guy on the right here, forward head, he's got the kyphosis going, a little bit of straightening of the curve here, tight hamstrings. Pretty much everyone with low back pain has tight hamstrings. So we want you to look as close as we can to here. I know it's not going to happen with everyone, but just trying to decrease the amount of strain that's placed on your body. It's going to help not degenerate your body as quickly if you were standing like the guy on the right there. Getting into fall prevention and recovery, I have some pictures of these in the handouts that were passed out, but we can go over that at the end. So upper body strength is very important, as well as lower body. So when you come into therapy for low back pain, not only are we focusing on that, but we want to look at you as a whole. So your balance, how is your balance? Are you high fall risk? Are you more of a low fall risk? And depending on that, we may focus a little bit more on that, or teach you how to get up and off the floor after a fall or something along those lines. After a fall, self-assessment is critical. So doing things like ankle pumps, heel slides, wrist circles, reaching up towards the ceiling, which we'll go over in a little bit. Those things can just allow you to see what's going on. I had people try to get up off the floor and they have a broken wrist and they hurt their wrist even more. So just want to make sure you're not hurt before you try to move. And another big one, no one picks you up unless they're 911 related. I had a patient one time, they They had fallen in their living room. The husband went to pick her up, and he fell. And they had called one ambulance, so now they had to triage. They have one ambulance, they have 2 people down on the ground. So really, if I would prefer if somebody's 911 related or medic, firefighter, something along those lines, if you have a big fall like that. And then at least a couple days, no more than 2-3 days later, if you have a big fall, it's best to get medically evaluated for any internal injuries, bleeding, compression fractures in the back, things of that nature. So some of those simple movements, just kind of pumping the feet a little bit, doing some heel slides, doing some wrist circles, doing some reaching up towards the ceiling, just making sure you're okay before you start to move from the ground. Moving on, so some fall prevention tips, you guys have probably heard all these, so check cords, make sure there's nothing out in the open, maybe rugs, things like that. Ensure proper lighting. A lot of people put night lights out for at night. Checking tubs and showers, just making sure there's either the non-slip, the gripping material at the bottom of the tubs. Clearing any clutter. We all do this. We have stuff, especially after the holidays, we have stuff everywhere. A lot of falls after the holidays, putting stuff back away, things of that nature. And then mats and rugs. A lot of people slipping on rugs and things like that, so they have the non-slip component there. So we'll go into some of the basic exercises to help prevent that, which can also help improve your core strength as well, which can help with low back pain. Chair push-ups, lunges, half kneels, crawling, scooting, and floor transfers. If there's a total knee or total hip replacement patient, typically no crawling for 6 to 9 months. That's kind of a doctor or surgeon specific. So scooting would be necessary, which I have a picture of that coming up. And then for those knee replacement patients, a lot of times you're looking at trying to create less stress on the patella or on the kneecap. So I have people, if 90 degrees is just straight up and down, if you're on your hands and knees, just bring the knees up a little bit more forward so you're about 95 degrees. That's going to take stress just off the kneecap and bring it down a little bit on the tibial tuberosity. And then life alert if alone at any time of the day, and phones that can be reached from floor. I've had patients, the daughter leaves for a couple hours to go to the grocery store, comes home, the mom's down on the ground bleeding. She's been there for a couple hours, so there's some scary stuff there. I've also had people, they've putting Christmas stuff away in the garage and they fall, and 2-3 days later the neighbor comes by, notices the newspapers are still out on the porch, and realizes that they've been in there on the ground for 2 or 3 days. So actually, if I've had people not want to get the life alert, and they've actually they have a newspaper delivered, and if you have a friendly neighbor, if they notice a couple newspapers out on the porch, say, hey, I get my newspaper at 7 a.m. every morning, you see it, if you see a couple of them lined up and I'm not out on vacation, maybe come knock on the door, check on me, call my daughter or whatever. So that's another option. Chair push-ups, so these, you'll hear us say a lot in physical therapy, engage your core. Anyone that's been to therapy, you'll hear us say that, strength, tighten your abs, things like that. So you can do that with chair push-ups. With this specific exercise, you're taking your legs out of it and you're just using your arms, working those triceps, which is gonna help you get up off the floor there. Half kneels, lunges, this is a great exercise for somebody that, if you can tolerate it, it can help to improve the strength of your core, your legs, your glutes. So, which in turn, the stronger your legs, your hips are, that's going to create less stress on your low back, because it's going to be, the low back isn't going to have to work quite as hard for certain motions. So with this person's on the picture here, she's holding a stick here for a little more stability. You don't have to go down and touch the ground, but just kind of simulating if you were getting up off the ground, holding onto a chair, standing up there, which we'll go into soon. Scooting, this guy is scooting on his rear here. This is for those folks that are in that 6 to 9 month range after a knee or hip replacement, so you don't put any strain on that replacement. Typically, I'd like to see the legs out straight, though, in that scenario. What to do if you fall: ease yourself up onto your elbows, move onto your hands and knees, hold onto the firm surface to support yourself, and then facing the chair, ease yourself up to a standing position, and then sit in the chair and then kind of reassess there. A lot of times what we tell people is make sure there's also phones easily accessible from the floor. So going into some functional change, so we're thinking stability first, so we start with supine isometric exercises, really easy. If anyone's been to therapy with us at Washington Outpatient, we typically we'll give you 3 or 4 exercises, see how you can tolerate it in the next few days between our first and second visit. And most of those are going to be done laying down and just working on strengthening your glutes or your abdominal muscles and trying to create some core strength or building that foundation there. And then we progress to more sitting or standing exercises, and then eventually working in several different planes. So we might have you doing a side step while pushing a ball out or something like that, where it's going to tax your core even more so. Core stability refers to the muscles that lie deep to the torso and creating a solid foundation for all other movements in the extremities. It can reduce persistent back problems. It creates less stress on the back. Weak core muscles leads to improper spinal alignment and positioning, and like I said, it can correct those imbalances with the core strengthening and reduce any uneven strains on that spine. And then, as I said on the last slide, working in those different planes to improve that core and pelvic stability. Superman here. Exercises to strengthen your back. So in the next few slides, I just have some basic exercises that most people can do at home to help strengthen their core and back. They're mainly for the main general population who do not have any back conditions, so it's kind of just a little disclaimer here. Again, if it hurts, don't do it type deal until you, if you get checked out by a physician or a physical therapist. So one of a nice easy stretch here, just a kneaded chest. And what happens here, you're just kind of getting everything moving. You're holding that you can hold it for longer than 5 seconds. I'll typically tell people maybe do three to five of them, hold it for 15 seconds or so. And you're just kind of bringing it up, you're holding it, and it's just going to help to stretch everything from your glutes to the low back, just real gently here in a position that's comfortable. You're laying down. Bridge and athletic bridge, there's so many different ways to scale things down or up. So the top one's a very advanced move. This is kind of an intermediate. A more beginner move would be just tightening your stomach muscles, tightening your glutes while laying down without lifting, which we'll go into in a couple slides ahead of here. So a lot of times I'll have my folks once we get to this point, if you can do an athletic bridge, have them kick the leg up in this position. A lot of times I'll have them do stuff with their arms too, moving out with the opposite arm out to the side, really challenging that core and pelvic stability, trying to keep those hips up in that position. So it's just a really hard exercise no matter what age you are, basically. Planks. So I had a fellow the other day with stenosis come in, and we were working on planks, and I said, let's do 10 seconds. And he wanted to see how long he could hold it. He held it for over 2 minutes. So this is a pretty fit fellow, but if you could scale this down by either being down on your knees and just holding that position, you can straighten out your arms and be on your hands versus elbows. So there's always a lot of different ways you can scale things down or up. You could even just lay on your stomach and just kind of lift your head up and tighten the core and the glutes in that position. I would suggest starting with 10 seconds or so. I don't suggest jumping right into 2 minutes like that fellow the other day. And then doing anywhere from 5 to 10 to start, and then working your way up to 2 sets of 10 like it says there. Pelvic tilt, this is similar to that, getting those abdominals and glutes setting, activating those muscles, tightening them up. So you're trying to basically flatten your low back onto the table, which is going to help with your core stability, your low back strengthening. This is a very low level exercise, but some people have a really hard time mastering it. So basically you're just tightening your stomach muscles, you're tightening your glutes, and it kind of just flattens that natural curve in your back into the table. That's something you could also do sitting or standing later on, but we usually start people supine because it's just a simple exercise to do. Usually holding it for 5 seconds and then relaxing the back to neutral, and then going for another set or another rep. And I usually start people with about 5 to 10 reps with that exercise. Hip abduction, I really like working the hip muscles with anyone on low back pain. As I said earlier, anyone that, if we can get your hips stronger, it's going to create less stress on your low back. I've had many patients go through that, and they've had great results, so I've kind of stuck with it. You can do it standing, kicking the leg out to the side, and it shows, it's hard to see, but she's wearing a resistance band around the leg there. We have those at our clinic. You can get them at Target, Big Five, wherever, and it's a great addition once you're able to do about 20 without the band, with no pain, and you feel comfortable with that. That's something that you can definitely move up towards. And then we get to more advanced or more dynamic moves, which is going to challenge your core more, like the side stepping here. He's doing kind of a mini squat there. And that's where you can also start doing things like pushing a small ball out in front of you, like a 2 or 4 pound ball or something like that. Small weights. You can add different stuff to it to really challenge yourself. modified push-ups. So this one, in this picture, the lady's doing it from her knees here. You can use a table, a wall. It would be the easiest way. You can start with a wall, just nice and easy. Just do a push-up. That's going to help you get up off the floor. Also tightening your core. That's a simple way to get some core strengthening going and low back strength as well. So typically, if somebody's really sedentary, we definitely want to start with on the wall, then work to using a table or a half push-up, and then going down to the floor and trying these. And this works with the plank exercise as well, because you're getting a lot of muscles going at once, the glutes, the abs, the low back, all at once here. And so moving on. So kind of touched on some of this earlier, but reasons for strength training include being out of shape, overweight, being excessively tired, looking better, osteopenia, osteoporosis, reducing the risk of falls and improving your balance, and then improving your ability to get up off the floor after a fall. Even if you're not a fall risk at this time, in 20 to 30 years you may be. So it's better to start now with some of these balance exercises, and so you can set yourself up for success. So these are some examples of exercises that you can do at home safely, but there are also other options out there for strength training and maintaining health of your back and core. So at our clinic, we also have, of course we have our physical therapy there. There's also our legacy strength training program. It's a cash program. You're doing a 30-minute circuit with a one-on-one with an athletic trainer. Weights are recorded and quantified by the trainer. Specific precautions are individually reviewed, and some of the benefits, as we talked about earlier, greater muscle strength, stronger bones, improved balance, all those things. So, and then those that should not attempt any high intensity program are those with health problems that need to seek advice of a physician or physical therapist before beginning. Trainees and beginners, this is where when the focus should be on learning proper form, correct breathing and mechanics. I've had several folks that breathing is so important. Most people hold their breath when they're doing a lot of these exercises, glute sets and all that. So we really try to focus on teaching that in the beginning before giving you a whole lot to chew on there, so to speak. And then rehab. So some clients will require an adjustment in intensity, range, and overall weight used. So regardless if you're going to physical therapy or using our legacy program or whatnot, it's always good to have another set of eyes on you there. This came out from the American Physical Therapy Association, I believe. Was that California Physical Therapy Association? So direct access is kind of it's a newer thing, but you're now allowed to, you don't need a physician referral to see a physical therapist nowadays. So you can get right in. You kind of cuts out the middleman, so to speak. You can get in, we can get going, and then if we see anything, we can refer you to the doctor or go on from there. And typically it's great for, let's say somebody hurts their back on the job or whatnot, or sprains their ankle or something. You don't want to wait 2 weeks to go and see your doctor and then 2 more weeks to go see your physical therapist, so we can get you in a lot sooner that way. And then in the middle there, it just has our address there on Civic Center. We're on the corner of Civic Center and Walnut.